Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today we're going to do one of the segments in a series we're doing called Nip versus Tuck. It's something that I'm trying to do to help educate patients about the cosmetic surgery marketplace, because it's very confusing out there, and what's going on and how to protect yourself. The article or the video we're going to go through today is titled, "Arizona Allows People Who Aren't Medical Doctors to Perform Liposuction and Brazilian Butt Lifts." So we're going to go through what are these type of doctors they're talking about, or not doctors, and then a little bit about scope of practice, the cosmetic surgery marketplace in general. And then in the end, I wanted to hopefully to get you informed and educated so that when you're seeking plastic surgery, you can hopefully find safe, quality plastic surgery with minimal risk. So we're going to jump right into the video, and I'm going to make some comments along the way, just throw in some education, some caveats, some points I'd like to make. So we're going to go ahead and play the video, and hopefully it's entertaining and educational.
For the 12 News I-Team, exposing a legal loophole that leaves some Arizonans vulnerable to getting cosmetic surgery from a person who is not a medical doctor.
And one patient learned about it the hard way after his liposuction procedure was botched. And as the I-Team's Bianca Bono explains, the lipo loophole is an open secret in Arizona's naturopath community.
After 2 years,
actually, I was on Groupon for something else.
Bruce Tucker still can't believe it was scrolling through Groupon that led him to where he is today.
Just a quick stop there. As I say, I don't know if it's really a surprise that Groupon led him to where he is today, because as I like to tell patients, you should never bargain shop for, like I like to say, parachutes or plastic surgery. And the reason is both can end in terrible disaster. You know, when you're looking for a plastic surgeon, I don't think you should be looking on these Groupon, coupon sites, because in general, these type of doctors may not be plastic surgeons at all. They may not be cosmetic surgeons. And the reason the price is usually cheap is for a good reason. So before jumping in, I think people always should do their homework and really try not to bargain shop for their plastic surgery.
No, I don't think I've taken my shirt off in public in 2 years. I don't look at myself in the mirror.
In 2019, Tucker saw this, advertising liposuction for about $3,000.
And it popped up, and it looked like a great deal.
So he contacted the office directly and booked it. But pretty quickly, Tucker said he realized the deal wasn't what it seemed.
Things were already going wrong.
Among the many issues Tucker would eventually lay out in a malpractice lawsuit, he said he could feel the surgery.
And it was starting to really hurt, to where I was like kind of grunting, telling them to renumb me because I was feeling every jab that they made.
So I hear this type of story all the time, and it could be somewhat frustrating, because patients will say, oh, I heard that liposuction awake is safer and you get better results. And that's not necessarily true. I think that actually it may be slightly cheaper, but on the flip side, it can be much more dangerous, much more painful, and the results can be worse. One of the reasons that it's cheaper is that when done awake, a lot of the doctors performing that sort of liposuction don't have to pay for an anesthesiologist to be there. It's not done in the proper operating room with the proper credentials, so they're doing it in a back room or an exam room. And in those instances, it's definitely not as safe, but the doctor makes more money because the money he doesn't pay the anesthesiologist to be there or the surgery center to be there, he can put in his own pocket. So they'll lower the price, but also lower the quality and safety of the procedure. And then secondly, as far as the results, the pain. Why is it more painful? Because you're not getting proper anesthesia. And the reason they're trying to, or the method of how they're trying to give you anesthesia is with a tumescent. So they're jabbing you with a cannula with numbing solution, but that's painful while it's happening. So when then try to blend outside of that area where that numbing solution hasn't reached, it's very painful. So when you're asleep, you don't have to do that. You're not going to feel it. You can blend it very well. The results can be very smooth. When you're awake, they put all that fluid in there. That not only does that obscure what you're doing, in other words, you can't see everything as accurately, which leads to contour irregularities and problems, because you're trying to do the lipo with all of this fluid in there, or overloaded fluid. When they go beyond the borders of where that fluid is, they can't blend it well because it becomes very painful. Next, as far as safety, because the patient's in pain, they can't tell the difference between if they're getting stabbed to death or whether they're doing liposuction. They're in extreme pain. And sometimes look at complications where the surgeon had actually gone through the abdominal wall and stabbed their intestines, and that's one of the worst complications that can happen. One of the reasons you see a lot of contour irregularities, problems, modeling in the skin is that because the doctors know when they go deeper, which is the layer of fat that should be done with the liposuction, not the thin layer of fat that's near the skin. That sort of fat should be left alone because it's smooth and keeps the results smooth. When you go in the deeper layer, which is what expands when you gain weight, that's the fat you want to take out. But because it's more painful when you're awake to go deeper like that, those doctors, when they leave you awake, will go in that upper layer. And when you go in that upper layer, that's when you get modeling in the skin, which looks like bruising or redness of the skin that can be permanent. Also, because they're going in that layer of the skin, you can get what's called cobblestoning. There's some famous people that have complained about that, not that I'm throwing under the bus, but like Tara Reid and some of these actors and actresses that have gotten deformities from liposuction is again because the surgeon or the doctor may have gone in the wrong layer of fat. So I guess, just in summary, I think when you go for a lipo deal, in other words, for that cheap liposuction, it's actually the lipo doctor that's making more money, and you're gonna possibly get a more painful botched surgery that can lead to permanent damage. So again, when you go for those deals, I just think you have to be aware of what's really going on behind the scenes, why they're offering these cheap prices, and what's the risk to you.
That they made.
And he said the surgery had lasting effects.
It just looked really bad, it felt really bad. 2 years it's still doing the same thing.
But the biggest shock coming after Tucker took a second look at the man who did the surgery, only to find he wasn't a licensed surgeon at all.
Yeah, I'm gonna stop it here because I still think it's sort of crazy that majority of people don't know that this is legal in the United States. This is a very common story I hear all the time in my practice because as plastic surgeons, we see a lot of these patients after they've been botched and they're asking us to fix them, and they'll come in and say that they had surgery and it went wrong, like this patient. A typical story from liposuction, they're in pain and they're awake and they're botched and they didn't understand what happened. And then we research the doctor and we find out they're not a plastic surgeon. Then we tell them that and they get very angry and they say this shouldn't be legal, but it is legal. And I think that people should be aware that you do not have to be a surgeon to perform plastic surgery or cosmetic surgery in the United States, or any type of surgery for that matter. The reason I'm telling you this is that I really think it's buyer beware in the cosmetic surgery marketplace, because with the mass marketing going on and Groupons and social media and the overflow of and overload of marketing for cosmetic surgery, patients don't know on the back end or unaware of these loopholes in the medical legal system and the licensing system. The medical licensing system hasn't caught up, and they haven't changed the scope of practice in the licensing of the doctors. There's actually more specialization in getting your car license, your driver's license, than there is getting your medical license. You know, whether a doctor is a pediatrician, an ER doctor, a family practice doctor, a radiologist, somebody that looks at x-rays, or a pathologist, person that examines dead people, all of their licenses say physician and surgeon on them. Because again, the licenses have not changed ever. Ever. So since the beginning of medicine, that's the same license with the same title on all the licenses. I know that it sounds weird, but all of these types of doctors have the same medical licenses, and all of them have been known to perform cosmetic surgery or plastic surgery. One of the easiest way that some of the doctors that aren't legitimate plastic surgeons will deceive you is they will call themselves cosmetic surgeons that perform cosmetic surgery. They can't call themselves plastic surgeons and perform plastic surgery. So you'll see in the ads or the Groupons, cosmetic surgeon or cosmetic surgery, and then it's up to you to do the background check to say, what does that mean? What type of doctor are you? What were you trained in? What is your board certification? Because once these cosmetic surgeons have you in their office and you signed an informed consent form giving them permission to operate on you, they can legally perform that cosmetic surgery on you, and there is no plastic surgery police. So once they've got you in the office, you sign the consent, they can legally perform cosmetic surgery on you. And I just think you need to be aware of that, or at least informed of that.
I actually blame myself. I felt really stupid.
The doctor who cut open Tucker's body was actually a licensed naturopath. According to Arizona law, the practice of naturopathic medicine involves non-surgical methods, though the license does allow for minor surgeries. But neither the law nor the license explains what a minor surgery is, and that leaves a gaping legal loophole for liposuction and other cosmetic surgeries. Even Brazilian butt lifts, which have a mortality rate as high as 3 to 4%.
I would say I'm shocked, but I'm not really shocked. The reason I'm making this video is I don't see things getting better. I've been kind of going over this topic for 10, 15 years now, and I don't see a big change in patients being educated about this. And instead of going the other way and patients becoming more informed or more restrictions on this practice, I see even more in the direction of, in this case, a naturopathic doctor that's not even an MD or a medical doctor being allowed to perform surgery now. Surgery can be based on urgency. It could be emergency surgery or elective surgery, and as the cosmetic surgery obviously is elective. In other words, it doesn't have to be done. All of these surgeries have one thing in common. They're all still surgeries. And I do think somewhat in a world of common sense, I think that surgeries, I should say, should maybe be performed by, say, surgeons. So I do think it's kind of in the name itself, and to me it's still confusing why those things haven't changed in the licensing, but I just want to make sure that the patients are aware of these sort of terms and what they really mean. In the wrong hands, these cannulas can be very dangerous. You can become permanently disfigured, and also, they can kill you. So you have to be careful that the term minimally invasive doesn't mean minimally dangerous in the wrong hands. There's been some studies done, and even in skilled hands, I think the numbers are 1 in 50,000 liposuction procedures leads to death, and BBL is 1 in 20,000. And we don't even know what the numbers are in these cosmetic surgery procedures that are done in back offices, or how high those actual numbers are. And like she said in the opening, the percentage or the death rate in Brazilian butt augmentation is 3 to 4%. So I think patients should be aware of that and really try to minimize the risk when doing these surgeries. I think in skilled hands, it's a very safe procedure, very well done conservatively, done safely. This is not a scary, dangerous procedure. And again, I want to explain is because people are like, oh, it's lipo, no big deal. How do these deaths occur? One of the reasons is the surgeon, of course. That's one risk factor you want to take out of the equation, make sure they're experienced, board certified, they know what they're doing. Number 2 is the anesthesia. Making sure the anesthesiologist is also board certified and skilled in what they're doing. And that leads into that second part when we were, talking about anesthesia, because when they're doing it in that back office, one of the other risks of the procedure is the numbing solution they use on you, because there's something in that numbing solution called lidocaine, and it's very toxic to the heart in large amounts. So again, in the back, and patients are in pain, and they just kept pumping them full of this fluid containing that lidocaine, these patients can get what's called lidocaine toxicity. And in large doses, it'll stop your heart. And these patients can die from heart failure. And then secondly, the most common cause of death, which sounds strange, is what's called a pulmonary embolism. And what that means, the patient develops a clot in their leg and it travels to their lungs and it kills them. And again, if you're doing this procedure in a back room, in a back office, you're not going to get all the prophylaxis or preventative measures possibly to prevent those sort of things. Because when you're going into an OR, they're going to be putting on squeezy boots and prophylaxis and watching you and trying to make sure that they're lowering the risks of these things. And then I think the scariest risk, again, is that skill of that surgeon, because with this liposuction cannula, there are stories where the surgeon had the wrong angle, or again, the patient was in pain, and they literally, stabbed the patient to death by perforating the abdomen and puncturing the internal organs. So again, not trying to scare you, I just think I'm trying to tell you, go to somebody who knows how to do this procedure, is properly trained in this procedure, do it in the right environment, in properly accredited surgery centers, proper anesthesia, and properly board certified surgeons, and all of these risks will go down significantly.
Even if it's done correctly, you can still have complications that are serious.
It's a very, very detailed, rigorous process to get to where we are.
Dr. Sean Lilly and Dr. Anthony Admire are certified by the American Board of Plastic Surgery. To become qualified to perform the procedures they do, they have up to a 16-year education.
So you have to have the knowledge of having various options that if you encounter a problem, how are you going to get that patient safely out of that issue?
Leading naturopath programs are 4 years, typically after a bachelor's degree.
When I hear naturopaths are now getting into the mix, it's really disappointing. They aren't even MDs.
And Dr.
So I was just going to comment here, because I looked it up myself. What is a naturopath? And I guess a naturopathic doctor goes through 4 years of school to get an ND degree, which is a naturopathic doctor. And the 4 years of school is, it says in their own words, is mainly to create primary care physicians who are trained to diagnose, prevent acute and chronic illness. Naturopathic medicine is a primary healthcare system that encourages the body's self-healing process through the use of natural therapies. And that sounds to me almost the opposite of liposuction. I thought these type of doctors would probably be encouraging weight loss and healthy diets, but to me it sounds a little counterintuitive that they're out there trying to perform liposuction now. Now similarly, I did look up their core main principles, and they are listed as first, do no harm; second, identify and treat the causes of illness; the healing power of nature; treat the whole person; and prevention. And again, I'm not sure where liposuction fits into that sort of dogma or that training curriculum. So to me, it's a little strange, again, that these sort of doctors pursuing that sort of education would want to jump into doing liposuction unless they had some other sort of motivation. And then by comparison, what kind of training do plastic surgeons have? Typically, by the time you become a plastic surgeon in private practice, you've completed somewhere between 13 to 15 years of schooling. You've gone through undergraduate, you've gone through medical school, you've gone through surgical residency training and plastic surgery training. All of that includes extensive training in surgery and plastic surgery. And then even when you get out to achieve board certification, again, it's many years of collecting cases. And then in the end, you're peer reviewed. In other words, you're examined by other plastic surgeons to see if you have the skill set, the experience, the knowledge, the ethics, the safety, the intellectual acumen to be able to do these procedures. If you're passionate about what you do, you're going to put in that time, that energy, that effort in the schooling. And if you're going to shortcut all of that, remember, those people that are going to shortcut that may shortcut you in your surgery. I'm not saying they're going to do that. I'm just saying it's something to think about. The other thing that I want people to know is that to get into plastic surgery is extremely difficult because it is a very competitive field. It's always in the top, most difficult training programs to get into. In other words, you have to be the top in your class, the best students, the best in your surgical medical school training. Remember, if you want a traditionally trained plastic surgeon, look for those words.
And doctors Lilly and Admire say it's clear that these cosmetic surgeries are not minor.
Both liposuction and the Brazilian butt lift are major surgical procedures and can have significant impact on patient if it's done incorrectly.
And state and national experts agree. The American Naturopathic Medical Association said, quote, real naturopathy never includes any of those procedures. And that's what Tucker thought too. So he tried taking action, reporting it to Phoenix Police, the Attorney General, and the Naturopathic Physicians Medical Board, which is tasked with regulating the profession.
So I figured they would take care of everything. That's not exactly what happened.
No, it wasn't. Tucker's case is spelled out in naturopath board meeting minutes and recordings that show the board decided not to discipline the naturopath for performing the surgery, though it did write a letter telling him to keep better records. And this was not the first time liposuction has come before the board.
Arizona by far has the largest scope of practice for a naturopath than any other state in the country.
Attorney Mark Ryan does not represent Bruce Tucker, but he's worked on another civil case filed against a different naturopath who performed liposuction on a different patient. That patient ended up hospitalized.
Liposuction is a major medical procedure that should be performed by a licensed allopathic or osteopathic doctor, period.
That case eventually settled for more than $200,000. But when it came before the naturopath board, members decided the naturopath had already learned a hard lesson and opted not to discipline her.
When's enough enough? Is it going to take the death?
I did find it strange, and it always, I wondered about why wouldn't that society or the naturopathic society limit the scope of practice? And I think it has to do with interest in certain fields of medicine. They don't want to limit that scope of practice because then doctors or people will be less interested in going into that field of practice if they know that the scope of that practice may be limited. And I don't want to say it's all about the Benjamins, but I will say that last year in the United States alone, Americans spent $1.2 billion on liposuction alone. It's a very lucrative field of business, and what's really driving this sort of scope of practice not being restricted may be greed, may be money. And again, I think that's why you need to seek out people that are really passionate about their job, have gone to the proper training, and are really more interested in giving you safe surgery with quality results, because otherwise they, like I've always said, they may be, possibly more interested in dollar signs than worried about your vital signs.
For the board to take action.
When the board's executive director declined multiple requests for an interview, we went to a meeting.
I wanted to make one last attempt to speak with you.
Only the executive director, Gail Anthony, and an attorney arrived in person. All other members called in.
Would the board then effectively be saying it is okay for naturopaths to perform liposuction surgery?
Well, you can come to that determination yourself. I can just tell you that the board did not make a determination that in any of those cases that the physician was outside of their scope.
That lipo loophole is no secret to Anthony and the board. Defining minor surgery has appeared on its agenda repeatedly. Members continue to avoid making a decision.
The board has taken it under consideration. They haven't made a determination yet. I have a meeting to begin, so if you'll excuse me.
And I don't think it benefits our patient or welfare if people who are doing these type of surgeries that don't have the adequate training and background to do them.
I don't want to mince words.
Yeah, so again, they're mentioning minor surgeries and this controversy, between minimally invasive surgery, minor surgeries. So one way that you can protect yourself is to do these. If you do the surgery and it's in an accredited surgery center or hospital, they can do all the background check for you. In other words, a lot of the reasons that these counterfeit surgeons, cosmetic surgeons, do these procedures in their back office is because they have to. They have no other choice. In order to get privileges to perform these procedures at a hospital or a legitimate surgery center, you can't get those privileges without them first doing a background check on you, and they'll look into your training, your board certification. Are you supposed to be doing these type of procedures? Because those type of hospitals don't want to take the risk. They know that surgeons that aren't properly trained, aren't properly experienced and board certified are a risk to the patients, and they can get sued if something goes wrong in their surgery center or in their hospital. So maybe avoid doing this type of procedure in a back office somewhere and rather seek out doing it in a surgery center or hospital.
Liposuction is not a minor surgery at all. Neither is a Brazilian butt lift. There should be no question about that.
This issue still playing out before the courts in Tucker's case. He's concerned if the loophole isn't closed, someone else is going to get hurt.
I guess we have to wait, but how many more people are going to get hurt or die while this goes to trial?
There are two ways to close this loophole: a new law or the board. Governor Ducey appoints the board members, and his office declined to comment for this story. We'll continue to follow up with lawmakers. Bianca Bono, 12 News.
I want to explain this in a way that it's not about egos, because people in this field or plastic surgeons, is not about like, oh, plastic surgeons are the best, or, facial plastic surgeons are the best, or dermatologists are the best, or cosmetic surgeons are the best. It shouldn't be about that. It should be about the patient. And hearing these stories over and over and over again for a long time, I don't want to say how long, but a decade and more, it gets very frustrating. And as a doctor, you want to speak out, but you also don't want to offend people. You don't want to offend other professions. There's probably some cosmetic surgeons out there that are trained within their scope of practice to do procedures, and that's fine, and I don't think there's anything wrong with that. They're well-trained, experienced, board certified in that scope of practice. They should be allowed to do cosmetic surgery. But it's the other ones that I call the counterfeit cosmetic surgeons that aren't really trained, that are causing all these botched results, and I think for them, it's almost like they should take a hypocritical oath rather than a Hippocratic oath, because we all know that the first thing that all good doctors abide by is first, do no harm. If they're out there botching patients and harming patients, these are the type of things that good doctors need to step up educate patients, inform patients, tell them this is what's going out in the marketplace. And the reason that I want to get some of these messages out there is so that patients can help protect themselves and protect themselves from harm. And it's not meant to bash other doctors, bash other professions. It's not what this is about. It's just meant to be educational, understand what is legal, what isn't. In the best way, seek out quality plastic surgery that is safe so that you get the results you want without the risk of all these complications and problems.
I believe Brazilian butt lift has the most, or the highest mortality rate. Is that because of doctors who are not qualified that are performing these procedures, or what makes the mortality rate so high on a BBL?
It can be all of the above, right? I mean, I think there is some of that going on where you just saw that if we could look at the mortality rate in board-certified plastic surgeons, in cosmetic surgeons, in counterfeit surgeons, I think you would see a wide difference in the mortality rates. Where were those studies done? Who were they looking at? You know, those sort of things I think would be very eye-opening to see that. But then secondly, I think because it's a big surgery and it's 2 surgeries in one, you're doing liposuction and fat grafting, and then the procedure itself, the liposuction part has its inherent risks that we talked about, and then the Brazilian butt hog has some inherent risks with fat embolism, and if you don't know the anatomy and how you're injecting the fat. And then, yes, it comes down to all the things we talked about in those procedures. Where are they being performed? Who are they being performed by? So all of those things are questions. But if you want to minimize the risk, right? If you're like, I really want to do it, don't be scared, but try to minimize your risk by seeking out those things. Like I said, doing it in an accredited facility, in a surgery center, and by board certification, all that stuff. You can lower your risk of getting those awful complications.